Okay.
Good afternoon, everyone. I'm Debbie Nadsam, the Project Director for VCSQI Support and Alignment Network 2.0. Thank you for joining us today or for listening later. This is being recorded. With us today are several members of the VCSQI staff, Eddie Fonner, Jana Eller, Ivan Burkle. Ivan is our new Transformation Improvement Advisor, and he will be commenting later following our formal presentation. So with us today is Brenda Kennedy. Brenda is the Quality Director of Our Care, a federally qualified health center headquartered in Augusta, Arkansas. It provides health care to approximately 90,000 patients. It consists of 34 clinics in Arkansas, 4 clinical sites in Kentucky, and 26 ancillary sites that include pharmacy and Ryan White Care Program services for residents of Arkansas. Their patient population ranges from small rural farming towns to a large urban area. And their highly effective teams have been able to dramatically improve depression screening and tobacco use assessment and cessation intervention for its population. They've maintained annual screening and intervention levels above their goal for the last 3 years. So Brenda comes to us with significant experience in her role at Our Care, and as you can see from her credentials, has definitely been focused on quality for a great part of her career. So at this point, I'm pleased to turn it over to Brenda Kennedy. Brenda?
Thank you, Debbie. Let's go ahead and go to the next slide, and we'll talk a little bit about our agenda today. We're going to be talking about the motivation for doing this work, about some of the basic quality principles and quality approaches that can be used. We'll look at current versus future states, some various quality tools that can be used, and then we'll look at the focus of this work, and then we'll let Ivan close us off. So I want to welcome everybody, and since there's only a few of us here, feel free to ask questions and discuss anything that we need as we go along. So let's move back one slide, Debbie. I think we went 2 instead of 1. There we go. So our motivation for today is we want to learn how we do our work, because how we do our work affects our patients, our team members, and our organization. And our discussion today will share with you some of the low-tech quality improvement methods that we can use to identify and develop streamlined ways that we can complete our daily work so that today's work is done today. Because after all, if we don't have time to do today's work today, when are we going to get it done? The tools that we'll share will also help us improve communication, understanding, and expectations between the team members. And that'll end up with reducing our frustration and decreasing communication errors that we know happen in clinical teams. We'll also use these tools to provide services to patients in a timely manner without preventable waits and delays, and that will result in improved patient safety and loyalty. And it also will improve our business sustainability by focusing on removing waste from our processes in ways that maximize our efficiencies and save us time and money. Next slide. So this just gives you an overview of what we found in our practice. And this was with one of our very first cycles of improvement that we did several years ago. How using these tools to work smarter, not harder, we had a 23% increase in revenue, even though we had a 29% decrease in encounters. And that was due to, billing more appropriately and maximizing the visits and those types of things. So it really can be done and provide more satisfaction to your patients and your staff, and hopefully return some of that joy to work when we're not quite so stressed out. Next slide. So after we looked at what processes and outcomes needed the most improvement, we began using simple quality improvement tools to work towards our performance goals. And we found that most of our problem areas were processes because we didn't have a standardization for how we performed this work. So for example, 50% of our diabetic patients didn't even have the standard hemoglobin A1C within the last 12 months, despite having at least 2 office visits. And only 78% of patients had a current blood pressure documented. So when we started looking at how and standardizing those processes, we were able to improve blood pressure control just right off the bat from 32 to 56%, our diabetes control from 38 to 65%, asthma control from 0 to 71%, lipid therapy from 34 to 81%, our adult weight assessment improved from 33%, which was just measuring the BMI, and we were able to improve that to 46%, which also included counseling if they were under or overweight. And then tobacco assessment and cessation, we improved that from 21 to 96%, and depression screening from 11 to 88%. So we had a lot of significant improvement just working on our processes. Next slide. So the purpose of improving quality is to help us meet or exceed the expectations of our customers. And those customers include both our internal and external customers. External customers include patients, insurers, regulatory agencies, such as the Joint Commission, NCQA, things like that. And then internal customers include the members of your care team as well as the organization that employs you. Quality principles should be used to improve all aspects of healthcare operations, including the products and services that you provide, the people involved in providing the products and services, and the processes used to provide those services, and the environment in which they are provided. And because of the constant changes in healthcare, this work is ongoing. So you'll see in the next slide, we've got to maintain that customer focus. And I'm sure that all of you have heard about the patient and family engagement work that is being done in TCPI. And so this is one of the ways that help us to focus on that. So we're going to look at the ways that we can use measures, people, and processes to support that customer focus. Measures include internal reports and benchmarking tools that determine how well our processes are working. And then quality tools are used to take that information and develop and track activities to improve performance. Under people, quality is built in how daily work is performed so that we are being proactive rather than reactive to customer expectations. And our care teams are empowered because each member knows the expectations of how the work is to be performed. With processes, standard work is developed and kept current through ongoing cycles of refinement and improvement, with a constant reminder that good enough is never good enough to meet the changing expectations of our customers. So now let's take a look at what our current processes look like. Does this ring true with anybody out there? I mean, you know, we have so many starts and stops and delays, and I know our organization certainly looked like that before we started taking a look at our processes. And just look at how much time is devoted to the actual process. There's really very little time that is focused on the work. Look at all those stops, waits, and moves, and how about the time wasted inspecting the work to make sure it was completed? We know there's got to be a better way. So now let's look at what those processes could include. You know, it's all the work that happens every day in our clinics. So any of those processes could look something like the depiction in the last slide. And as a member of the clinical team, you are empowered to identify opportunities for improvement, problem solve, make suggestions for improvement, and help in getting the change adopted in your location. Not every good idea can be afforded, but there are usually minimal to no cost changes that can be implemented that will have a significant impact. And so here we've just got some ideas of things that we worked on in our organization and that are part of the daily work in most clinics. So there may be other things that you would want to add to this as well. So let's look at what future processes could look like using some of the tools that we're going to share with you today. If we're willing to take an honest look at how we are doing our daily work, including being willing to get rid of those sacred cows. You know what sacred cows are. It's doing something just because that's the way we've always done it. Well, then we already have the foundation for making drastic and sustainable improvements. So look at the processes that you have in your daily work with a fresh perspective and be willing to think outside the box. Remove the waste, the rework, the inspections, the moves, and all those things will help us work smarter, not harder, and we'll get today's work done today with accuracy that will improve the satisfaction for all of our customers and ourselves. So let's go to the next slide. So these are some basic quality tools that we're going to cover today, and that includes process mapping, data and reports, action plans, PDSAs, and standard work. These are all simple tools that can be easily used despite the team size or the complexity of the organization and the services. It really does fit all. So the first one we want to talk about is process mapping. You go to the next slide, please. And so the process mapping in our organization was one of the most valuable basic tools that our teams use to identify problem areas in a process. A high-touch, low-tech way of process mapping involves taking some table paper and putting it up on the wall and then using sticky notes to document the steps in a current process, and that includes any waits, moves, or rework. And then those sticky notes can be easily moved around the paper until the team has consensus that an accurate workflow is depicted. And as gaps or waste are identified, the team can then problem solve and develop new processes to streamline and standardize the work. So let's show you an example of that on the next slide. So this is an example of process mapping for a fecal occult blood test performed at a clinic. The patient is given the cards for testing at home and is expected to return the cards after a few days for testing. Seems like a pretty simple and straightforward process. But what happens if the patient fails to return the cards? There's no time frame identified for follow-up, and no follow-up steps are determined for how to handle that routine occurrence. So guess what? A gap occurs and the patient falls into the crack. The second problem area is that the nurse schedules an appointment for a colonoscopy if there's a positive FOBT result. But what happens if the patient fails to keep that appointment? Again, there is no standard process identified for follow-up, so closing the loop could be hit or miss. No one is clear on how this work should be completed or who should do it, and that results in the need for reviews and additional rework to make sure a gap in care hasn't occurred. So let's look at an after view of what this process could look like where we're closing those gaps. So the team has identified how to address the gaps that were found in the first process. Those are the boxes in green. So now the entire team knows how orders will be reviewed for completion of the FOBT test, as well as how to follow up on whether or not the patient kept the colonoscopy appointment and the receipt of the results. So this is a simple, easy process that the staff can do. And there again, you can just use sticky notes to do this and use the 2 colors or 3 colors, however many, whatever the team agrees on to accurately communicate what's happened. And I know we still have our first process map that we did on some insurance work on how our billing department worked. And oh my goodness, it is so interesting to keep that and go back and review that journey of what a massive monster that process was in the beginning and how much we have been able to shorten and make it a much more accurate process using standard work and process mapping. So let's move on to the next slide. And I don't know if there's anybody here that is interested in having a discussion, or if it's all some of Debbie's team members here. But if you have any processes that you could think of in your current work environment that could be improved with process mapping, I would encourage you to enter your responses in the chat box. And, you know, it may be an example that we gave already, and it may be something new that you have found, that you've thought of as we've gone through this presentation. So let's see, is there anybody out there that has anything to talk about?
I would say feel free to unmute your line and just speak if you want.
Absolutely. And of course, for those that are viewing this presentation later, feel free to talk to Debbie and Ivan and the rest of the team about any opportunities that you see where they could help you streamline some of these processes. Okay, well, let's go ahead and move on. We'll go on to the next slide. So you can see in data and reports, we have to continually measure to know where we're at. And with health information technology, we have a lot of information available that we can use to help us determine our priorities so that we don't fall into the category of being a drip. And that means data rich and information poor. So once we've identified our priorities based on the data, then we determine the most meaningful way to share that data in performance reports. And sometimes that looks differently based on who is receiving the information, leadership or frontline staff. And so the performance reports are used to communicate the current level of performance along with the performance trends, either positive or negative. And this communication can be used by the care teams and support staff to identify specific actions that can be used to improve processes or outcomes. And I know in our organization, we have modified and changed these reports on numerous occasions to make them more meaningful to the users. And so they don't look anything like they did years ago when we first started this work. And of course, we have added new measures and communicated the information through different mechanisms as well. So you just have to find what fits your organization. Next slide. So now we can see where the three elements from data and reports is used in the completion of an A3, or what we like to call an OSI Action Plan. OSI meaning opportunity for improvement. So we found this to be a highly effective communication tool for helping teams identify the opportunity that they want to address based on the current results for that process or outcome and the expected level of improvement. They can then document the analysis of what is happening currently, as well as any new actions that they will perform to improve, including the details of who, what, when, and how that work is going to occur. And then after a defined team, in our case, a defined time, the team agrees to review that information, and in our case, it's usually at least monthly. The actions and results are then reviewed by the team to identify what worked and what didn't work, and whether or not additional actions need to be identified for the next time frame. So this tool can cover daily, weekly, monthly, or any time frame identified as most appropriate by the team. And in our organization, the quality the clinical teams fill these out and submit them to the quality team so that we can review and assist and monitor their progress as well and give them feedback as necessary. Next slide, please. So here is an example, and it's a little bit difficult to read, but this is just how simple this tool can be. It can be very detailed, or it can be more of a high-level outline of the actions that are going to be taken. So in this example, the clinical team chose aspirin therapy, where we have a goal of 80% of all of our patients with hypertension, diabetes, etc., would have aspirin therapy, if not contraindicated. And so you can see they noted that their current rate at the date of this OSI Action Plan was 57.14, and their goal, which was kind of a stretch goal to improve that much, but they wanted to increase it to 75% within a 1-month time frame. And so you can see they put that the nurses were going to document if the patient was taking aspirin, and then the provider was going to prescribe if they were not taking it. And then they would request additional information from the patients at the next visit to make sure that they were taking that. And so the team agreed on that, and you can see that they noted that the goals were met, and so they established another goal to meet by the next month so that they could continue to strive towards reaching the organizational goal. So very simple, easy to file away. I don't think anybody had any problems understanding this, and this is something that is used by everybody, including front office, all the way through to the providers. So now let's look at a PDSA. This example is one where we were looking at self-management goal setting for patients. And so they were testing self-management goal forms on patients and chose the one that staff and patients preferred. And so this is, usually PDSAs are very short, time-specific. What can I do today or in the next couple of days to test a small change and determine whether or not that's going to be effective? And so they looked at this at one facility, and they selected 5 patients during that week that were diabetic to test the patient form on. And so when they got the feedback, they were able to refine that form a little bit more and determine whether or not there was another test that needed to be performed or whether it was ready to be implemented. So this is a good thing to use to test those small changes, but then also to communicate it with enough detail that it can be replicated in other areas so that we can spread change that is successful and help to gain some momentum instead of everybody having to test the same thing. And so there are a lot of these types of resources that are available on the Healthy Communities website. And so don't hesitate to look through those if you have questions about specific things that specific areas that you're wanting to improve. So on the next slide, let's look a little bit at standard work. So standard work is one of the most powerful quality tools. It's a key foundation for lean thinking methodology, and it looks at eliminating waste and reducing variation in a process. And so by documenting the current best practice, standard work forms, and it creates the baseline for continuous improvement. And as the standard is improved, the new standard becomes the baseline for further improvements and so on. So questions you can ask to develop a standard could be things like, how do people work? How often is an activity done? How long does that activity take? How do you know when you've done a good job? It can also ask questions about how do people connect, who interacts with who, and how do you send information to each other. We can look at how the work is improved. So when something goes wrong, what do you do? And how do you prevent problems? So it's more about being proactive and everybody understanding what is the one best way to get the work done so that everybody knows the expectations, and it shifts the blame from the worker to the system and helps to facilitate change, because since everybody's doing it the same way, it's easier to identify further opportunities for improvement. So let's look at some examples of standard work. So these are a couple of different tools that we've been able to use in our organization, and examples that we found from other organizations. And there are a lot of different standard work templates. Some are more simple, others are very complex. and they include the time to complete each step of the task, and could even include an environmental map to help visualize each step of the standard work. So in the example on the right, team members evaluated the way that they labeled specimen tubes and looked critically at their successive check process. And they discovered that in a 1-month period, the process failed to catch 3 mistakes. And since they had more than 30,000 patient orders per month, that meant the process had a 0.01 defect rate. So that seems pretty low and might be seen as acceptable in some organizations. It wasn't acceptable for their patients, who of course wanted 0 mistakes. And they knew that a lab mistake could translate to a delay, a misdiagnosis, or even the wrong treatment in a patient's care. So they analyzed the process, eliminated waste, introduced standard work and instruction to ensure that all team members were fully trained in the new standard process. And the standard work that they developed helped the team achieve 0 defects in the next 6-month period, and it defined the standard methods that all new team members were trained from that point forward. So it not only has these tools not only have a benefit for helping to identify the best way to do the work, but it also is valuable as a training tool for new staff, as well as a model to evaluate staff performance objectively. So we have another discussion area here that we'll look at on the next slide. And so we just would like for you to think about those 5 different tools that we talked about and what might be most helpful in assisting you and your clinic to identify current opportunities for improvement. And remember, we talked about process mapping, data and reports, OSI Action Plans or A3s, PDSAs, and then standard work. So does anybody have any comments or want to put anything in the chat box here? Okay, well, we'll move on to the next discussion area that we were going to cover. And there again, this will be something that you can discuss with Debbie or Ivan and the rest of the team. We can go to the next slide.
I'm trying. It's not advancing for some reason.
It's frozen up. Well, on the next slide, what we wanted to have you think about is what tools you might currently be using in your practice, or any additional requests for information that are related to the discussion that we've had today. You know, most practices are using some type of one of these 5 tools that we've talked about, may not be using it fully and maximizing the benefit of it, but all of these tools that we talked about today, you can use to add in and build on things that you're already doing. They don't have to each stand alone to gain that momentum that you need to help make that transformational change that we're all being called to do. So is there anybody that wants to share anything that they're doing now?
In your experience, Brenda, this is Ivan. In your experience and observations, which of these tools are the most challenging for practices or for individuals to adopt and really understand and use the right way?
I think probably data and reports. And I think that's because it's sometimes difficult for teams to understand what is most valuable. You know, there's a wealth of information out there. And sometimes it is difficult to get that information out of our systems in a way that is meaningful, that we can get benchmarks, that we can compare our results to other organization results, either internally or externally. But that really was a struggle for us, and I know that my involvement in TCPI, I've seen a lot of other agencies struggling, but if you can't get that data and reports in a timely and meaningful manner for the team to use, it's really hard to know where they're at and what's most important to begin on. And so that's probably what I would say is the most important and the most difficult both. Have you had any experience with that, Ivan?
I've had, I mean, experiences with just the challenges of getting data, of you know, extracting it from the most reliable systems, from even identifying the appropriate process metrics that are driving the outcomes that we're trying to work on. So yeah, it takes, you know, those are the things that take a lot of, you know, discussion, a lot of team involvement, maybe to look other than the obvious places for data and information, and to see what other opportunities are out there. But that's certainly, you know, a challenge when you get into the heavy clinical issues, especially.
Yeah, but it's so important. You know, we found after we had more health information technology to help us that we almost had to work backwards to figure out, okay, what is it that we need to measure, and then figure out the processes and through process mapping and standard work that needed to be completed so that our data was accurate. Because
right.
You know, we weren't always able to capture exactly what elements were needed to make sure we had an accurate result. And so until we could standardize the clinical processes so that we knew that information was always available within that certain spot at that certain time, then we couldn't be confident that our data was correct. And we had a lot of kickback from people believing that the data was not correct. And when we were able to finally drill down and be able to assure them that, yes, it is correct, because they would send us patient names and say, I know I did this, that, and the other on this patient. Why is it not giving me credit? Well, we could do a reverse process and drill down and look at that information and see, oh, well, you put it over here instead of putting it here according to the standard work guidelines that we have. Right. That's why you didn't get credit for it. It has to be according to the workflow for it to count. And so that's that circle that we're continually having to look at, because with every software upgrade, we have to go back and reevaluate and make sure that something hasn't changed in the reporting, and that it's still capturing in the right place. So there again, you never can afford to say, okay, our work is done, everything's good. You've got to constantly be vigilant about reviewing that. And if you start seeing a decline, it may not always be that staff just aren't doing something. It may be that your reporting is capturing it in a different way, and we need to retrain or reevaluate that process. So yeah, it's a hard one.
You know, I would add that the other important point that you just made is the importance of using the tools to document what we've done, so that way when something new happens or something changes, we can go back to that process map, if you will, and look at it and evaluate it, or go back to the standard work and see, okay, in this new environment, what do we have to tweak or change in order to create a new process that works for everyone? And I think that you also spoke to the importance, even though these are all tools that are very strong tools on their own and can be used, independently to make a plan with the A3, or to, to find a problem with the process mapping, or to, implement a small test of change with PDSA. I think the way you, told that story explained also how those tools can be used together, how we can use process mapping to help us find a problem that then we document the standard work for, so that we're all on the same page with respect to who and how we're going to do this process. So I thought your comments on that also spoke to some other things that I think are very important about these tools.
Thank you, Ivan. Yeah, and that's one of the things about standard work. We even use that in our orientation program to teach new employees how to do their job and evaluate them against that standard work. So it just so clearly communicates the expectations to all of the staff and helps them to understand how their upstream and downstream customers, including their coworkers, are affected by the work that they do. Because without those, it's really hard for them to understand they're operating in silos. And so when we have that standard work and everybody can see the stream, the whole process stream, it really does become eye-opening and help build that team rapport, that team respect, and identify areas where we can maybe even further streamline by pushing things down to the lowest level, and removing some of those bottlenecks. So in other words, if a nurse can do something, don't expect the provider to do it. And that's been one of our biggest successes, is finding other care team members that can do some of the work, because the provider is going to always be the bottleneck, almost always. And so by pushing that work down to the lower levels, we've been much more able to affect those larger, much more transformational changes. And our providers are so thankful for that. It lets them get back to really being able to focus on the patient and helping them improve their health and achieve the goals that that patient wants, whatever those are.
Absolutely.
So, thank you. Okay, does anybody else have anything else they'd like to bring up? Well, I guess we'll move on to the next slide then. If it'll let Debbie move.
I'm trying. It wants people to talk.
I know.
Well, it'll kick on in a minute here. I don't know, maybe the longer it sits on a screen, the more stuck it gets. I'm trying to escape out of the screen show version and just go to the slide, but it's sort of locked right now, so.
Okay. So,
there we go.
There we go. Well, we've talked about 5 different tools that can be used to help with improving how we do our daily work. And, I keep saying how and putting the emphasis on how, because that is one of the most important things that we can address to streamline operations in our organizations. So when we can center our attention on what we do, why we do it, then we can concentrate on how we do it. And improving the how of what we do will help us to meet the expectations of our customers and improve satisfaction and loyalty of our patients and our staff. We always talk about patient-centric, and yes, that's important, but we've also got to remember those other internal customers that are our coworkers. And so all of this work is designed to benefit both. We know that that we can't achieve success without the buy-in from the clinical team, the administration, and everyone that helps provide the service to the patient. And so it's very important to look at these three things: what we do, why we do it, and how we do it. And most of all, we've always got to remember that the greatest of all mistakes is to think that we can only do a little. A little change today can result in another little change tomorrow, and we can continue to gain momentum until we have transformed our outcomes, our processes, our whole organization, our individual patients, our populations, and our communities. I've seen it happen. I know it works. And so I just want to encourage everybody that when the work seems overwhelming and the tasks too many, to always go back and remember that we can always do a little better every day. So at this point, I will turn it over to Ivan and let him talk about and close us out.
Thank you, Brenda. I will share some closing thoughts. First of all, thank you again for taking the time to share those tools and give an overview with this group this afternoon. If we think back to what some of the critical success criteria are for this project, one is to make sure and work with practices to make sure that they are aware of and educated on and comfortable with basic QI tools that they can use to help them work through this transformation process. And another key criteria is to work through the 5 stages or the 5 phases of transformation successfully and do so in a timely fashion. And I believe that the 5 tools that have been talked about today are all of the tools that practices need to successfully address the milestones and the criteria that are talked about in the assessment. The assessment is asking us to document how, again, that's that word that Brenda stressed, how we do things. Or it's asking us to make plans for how we're going to do things and create a standard and make sure that we're doing it in the practice. It's asking us to set aims and work toward those aims and continue to make small improvements in the practice. That's the data, that's the measure, that's the PDSA, the making the small test of change to improve things and make once we practice them a few times are the tools that we are going to use to address each of the milestones and take our practices and our clinicians through each of the phases of transformation. As Brenda said, the tools are easy to use. For those of us that work with practices and train on these tools, it's important and easy to take and share with other people, and easy to share with other members of the team and other folks in the practice. So again, these are tools that we will use in our role as advisors and partners to our clinicians and practices who are working through this transformation. Brenda touched on it, but I'll state it again. A big part of the philosophy of lean and a lot of this thinking is to empower frontline staff, the front of the house, the back of the house, our nurses, everybody in the office to problem solve and contribute toward the practices, progress toward goals that we're trying to reach. So I hope this has been valuable. These are tools that I've used for years with dozens of practices all over the country, and they are tools that I will use with the practices that I feel privileged to help support throughout this journey.
Thank you, Brenda and Ivan. At this point, we will close our webinar and hope that, again, as Ivan said, these tools have been valuable. You'll be hearing more from us about them and how to use them to improve the value of care that your patients receive. Thank you both again, Brenda and Ivan.
Thank you.
Thank you, Debbie.